Welcome to Week 2, Chapters 11 and 12, Legal and Ethical Dilemmas in Case Management. Case managers are licensed professionals who have an obligation to perform their responsibilities in accordance with standards that can arise from several sources: standards of care, standards of case management practice, and clinical practice guidelines. Malpractice is negligence, misconduct, or breach of duty by a professional person that results in injury or damage to a patient. In most cases, it includes failures to meet a standard of care or failure to deliver care that a reasonably prudent case manager would deliver in a similar situation. There are 4 elements of a malpractice lawsuit. To prove malpractice, an attorney must prove all of the following. 1, the case manager had a duty to the patient. The duty is established by the standard of care. 2, the case manager breached that duty. 3, the patient suffered injury or damage. 4, the case manager's breach of duty is the cause of the patient's injury or damage. Because malpractice claims are under state jurisdiction, the process of claims management varies from state to state. Some states limit the amount of damages plaintiffs can recover in an effort to curb frivolous lawsuits and keep healthcare providers' insurance at a reasonable rate. Some states offer arbitration process prior to trial. Although the case manager role is not a hands-on nursing role, there are a number of potential issues of liability that can concern case managers. Failure to follow the standards of care, failure to communicate, failure to assess and monitor, failure to plan, failure to document, unsafe discharge or failure to support patient transition effectively, and failure to act as a patient advocate. A consent authorization form signed by the patient or the person authorized to act on the patient's behalf provides for the release of information to the case manager and certifies that patient's permission to review case information with the treating physician, other health care providers, the payer, the employer group, and so on, when some data must be shared to further the case. A consent form can be a very specifically written or broad-based to cover a number of medical situations, but it should authorize access to information for the duration of the case. A copy of the consent form is kept on files and accompanies all case management reports sent to a physician, lawyer, claims examiner, and so on. For long-term cases, a consent form should be signed annually. The process of informed consent includes providing the information verbally and in writing, providing an opportunity for questions and answers to clarify patient understanding, the signing of the consent form, retention of the current consent in case management records, and the legal standards for disclosure. The failure to complete the process for informed consent may result in misunderstanding and ultimately to liability for negligent consent. Nurse licensure is regulated on a state-by-state basis through successfully passing the National Council Licensure Exam, also known as the NCLEX. State boards of nursing require nurses to be licensed within the states where patients reside whenever telephonic or on-site interventions occur. If a nurse practices without a license to practice in the state where the patient lives, he or she is violating the law. As healthcare professionals, case managers are ethically charged to maintain the maximum amount of confidentiality possible on matters of healthcare and finances on behalf of patients. Confidentiality touches on a number of issues and relationships, regardless of the health plan and their health status. The retrieval of information is not arbitrary or procedure. It can be argued that providers, payers, case managers, and patients all have rights, and in fact they do, but in particular cases, the rights of one group will override those of another. Key pieces of confidentiality legislation were debated in 1996 and 97, with elements of the Health Insurance Portability and Accountability Act, known as HIPAA, and the Patient's Right to Know Act, opening up debate on how to prevent breaches of privacy. The overarching legislation now in effect is HIPAA, which calls for full disclosure of patients regarding how their healthcare information will be used and who might see it. Case managers have strict, well-defined confidentiality policy, operate within the informed consent of patients, and get adequate and valid release of consent authorization forms for all disclosures of confidential information. In 2009, the Health Information Technology for Economic and Clinical Health Act was enacted to regulate the use and misuse of electronic protected health information. It was later updated in 2012, and the High-Tech 2 rules were released in 2014. Among the policies to be implemented to comply with this new rules are the reasonable appropriate physical security must be implemented to secure computing devices, password protected, and several other regulations. One of the tenets of ethical practice is veracity, telling the truth. A case manager preparing marketing materials will want to avoid overemphasizing capabilities or guaranteed results. In Warren v. Lincoln National Administrative Services Corp., a jury awarded Warren $26.8 million for his school's district plan because it did not cover his liver transplant. The benefit plan language clearly stated that the surgery was not covered. However, the plan's benefit procedure included organ transplants as covered procedure. The jury felt that the plan's denial of payment was a bad faith action. When referring a patient to a facility or provider, case managers have the responsibility to act in good faith in the best interest of the patient, to investigate the competency and qualifications of the facility or provider, and to use reasonable care in making the referral. The more choices a case manager offers the patient or physician, the less her risk of being held liable for negligent referral. No case manager has to be a lawyer, but it is important to have current knowledge of case management professional guidelines. There are conferences specifically for case managers, as well as training seminars, a host of national conferences relevant to case managers, and magazines and professional journals that cover pertinent issues. Liability insurance is necessary for all healthcare providers, including case managers. Although nurses, social workers, and other professionals engaged in the provision of case management services frequently have professional liability insurance, the roles and responsibilities of case manager are somewhat different, and specific liability insurance is strongly recommended. Far too many case managers today believe they are covered by their employers. This is far from accurate, and each individual needs to obtain a separate policy. They are very affordable and provide not only excellent coverage and representation if the need arises, but also peace of mind knowing that one is protected. The Patient Protection and Affordable Care Act of 2010 will accomplish a fundamental transformation of health insurance in the United States shared responsibility. The ACA will expand eligibility for Medicare, Medicaid. It provides enhanced federal support for the Children's Health Insurance Program, known as CHIP, simplifies Medicaid and CHIP enrollment, provides new options for long-term services and supports, improves coordination for dual eligibility. Chapter 12. The moral principles and ethical values of autonomy, fidelity, justice, and veracity are at the core of patients' rights and case managers' responsibilities. Autonomy is a respect for the patient's right to self-determination. That is, we ought to respect the patient's right as much as possible to make decisions about his or her own care. Justice is the maintenance of what is right and fair. Case management was a direct response to both technological advances and monetary constraints and issues. But because we sit squarely in the middle of the healthcare process, we now must deal with these ethical problems. The ethical challenges and responsibility we face heighten in direct proportion to a patient's degree of impairment. When a patient cannot be a partner in care due to cognitive or speech difficulties, acting out, or inappropriate or impulsive behaviors, a case manager's ethical responsibilities increase. When cost control issues are involved, ethical dilemmas multiply as well. If an insurance company initially refuses to pay for medical indicated treatment, it is ethical for a primary care doctor to lie to get a coverage for. Is it ethical for a primary care doctor to lie to get coverage for a patient? How many case managers might misrepresent a condition to get the coverage of a patient desperately needs? To assist case managers in their day-to-day practice, our industry has responded with standards of practice and codes of conduct. The CMSA issued the CMSA standards regarding ethical case management practice to provide guidance to the individual case manager in the development and maintenance of an environment in which case managers' practice is conducted ethically. If more case managers were to use the listed documents as they define roles and responsibilities within their departments and make them active working documents, it would help eliminate some of the problems they are having. It would give them recourse when faced with choice presented by an employer that they feel is unethical.